Today, we have the pleasure of speaking with Sanketh Andhavarapu, the co-founder and chief product officer of Vitalize Care, a venture-backed startup that works with the healthcare employers to improve the mental health of their staff. Sanketh has been recognized as one of the top five entrepreneurs under the age of 25 in Maryland by the Baltimore Business Journal for his work in the field of healthcare. He has published over 20 peer reviewed publications on healthcare and clinical topics, including the largest systematic review on PTSD rates among healthcare workers during the COVID 19 pandemic. Prior to Vitalize Care, he led business development for a new innovation at pediatric health tech startup and also founded an education nonprofit. Sanketh is passionate about improving healthcare by leveraging digital health, behavioral and decision science, and health policy. We are excited to learn more about his experiences, insights, and future plans. So let's dive in and hear from Sanketh himself. Sanketh, welcome to Anuyat, and thank you so much for taking this time out. So thank you again for doing this for us. Putting out my first question, what is a specific problem for the healthcare employers that Vitalize Care app is addressing? You are trying to address it on your Vitalize platform.
Yeah. So, I'm glad to be here. And right now in the United States, over 60% of our healthcare workforce is burned out. And burnout means they're losing their sense of purpose in medicine, they're emotionally exhausted, they feel disconnected from their patients. And obviously, this is a very high percentage, and it has significant consequences for the quality of our healthcare system. It's costing us over $60 billion annually and is sacrificing our ability to deliver high quality patient care. And so with Vitalize Care, we're working with healthcare employers to improve the mental health of their staff and hopefully retain them, reduce turnover, and improve productivity. Specifically, we noticed that there was a gap in resources tailored to the unique challenges of working in healthcare, meaning healthcare workers face a unique set of challenges every day, and it's important that they're able to speak to people who understand that, who are trained in communicating with about those challenges. So that's the gap that we're trying to fill. And it's been super exciting working towards this mission, and we've loved Anuyat's commitment to this mission as well, and working with us to address this huge problem.
Yeah, I'm always happy to do that for sure. And we always, I personally, I always admire, what you looking forward to provide to the healthcare workers, because we have seen a lot of similar episodes of healthcare workers getting burned out and feeling very emotional during, of course, during the COVID times. So yeah, I totally understand what you're trying to, what Vitalize is helping here. Anuyat and Vitalize have worked together for over an year now, right? So how did you find Anuyat and choose us as your, technology partner? What made you led to the decision? So really wanted to, would love to hear this.
Yeah. So I found Anuyat on the platform called Upwork, where we made a posting for this opportunity where honestly we needed more technical bandwidth. We only have one CTO right now, our Chief Technology Officer, but to build out a full end-to-end platform, we needed more help. We needed to build at a faster pace, especially because we had, a pilot and then an annual contract coming up with a hospital. So how we selected Anuyat, so funny story, we actually worked with an outsourced dev team about 2.5 years ago for a similar problem, similar product, but we were very unsatisfied with their communication, their just ability to follow instructions, their ability to co-develop with us and think critically. And so we kind of knew what we were looking for when we selected a new team. We knew what not to look for and we knew what to look for. And so I remember doing almost 3 to 4 calls with Jivan and Anuyat's team before recognizing that I think we thought it would be a good fit. And we started off with smaller scopes of work just to kind of test out the relationship, see if everything was, if the dynamic was working well. And after we realized that we were happy with the work that was being done, we were able to give more responsibility to the Anuyat team and work more closely on developing the MVP for our product.
Right. We're glad that every piece fell on the right side, right? Yeah. Because the communication during initial stages of product, when it's an idea, just an idea, it's very important that it comes out to be good, especially in the MVP, right, where you're trying to figure it out that whether your idea would work or not. So that's very important. As you rightly mentioned, communication is the key here. During the MVPs. Another question I would like to ask you is that there must be, during the first few months of the project initialization, there must be some challenges. There was some, what you can say, tell us about some challenges or the engagement that you and Anuyat had in the beginning, how the project went on and how it started, and what were the key challenges? Like one, you said that was the communication with the earlier team. So you started with the smallest requirements, and then we went on with the bigger ones. Yeah. Other than that, are there any challenges that you found while during the initialization of this project?
Yeah, I think during the initial phases, as I mentioned, we were doing more small projects. It was a scope of work type of agreement. And one thing that was a challenge with that sort of agreement was the team was very committed to the detailed specifications that we outlined at the beginning of the contract. But as many people who have worked in a startup type of environment know, specifications will change very quickly, new ideas will come, new feedback will come, and it's really hard to build out a product roadmap or features 2 months in advance because you never know what's going to change. And so that was one of the initial challenges we had with the Anuyat team, where we would work with them and we would have a new idea or we would want to change something, but there was some resistance there to deviate from the initial script or assigned tasks. But we were able to resolve that by moving to a monthly retainer model, where instead of working with the team on a feature basis, we had them full time for our support. And if things changed or if we needed to build more, if we needed to adapt to something, the team was there with us and was willing to adapt because obviously they're going to get paid the same amount at the end of the month. And so they were almost like a partner as opposed to just a contractor.
Right.
Yeah, so, and Anuyat has been very receptive to supporting our product roadmap as we go through these ideation phases, as we think about which features are higher priority versus lower priority, which ones are more technically challenging than others, things like that. So yeah, I mean, there were definitely challenges with any new relationship, but I think we were able to figure it out and keep moving forward.
Of course, I totally understand. And while following the agile methodologies, it helps us to and fro between the changes that we have during during the initial phases of the project. Yes, we have been following Vitalize on LinkedIn, so you guys are everywhere, like all things, and you guys are putting really good efforts in getting out there and helping and trying to put out that idea of Vitalize Care, so that more and more institutions and more clinics gets attached to Vitalize Care. Right. So, and we are happy to see how it is recognized within the health industry. So, tell us more about the company's achievements so far. Would like to share with us?
Yeah, for sure. So, actually, very recently, just a week and a half ago, we were able to close our first funding round, where we raised about $1.1 million. And that's a huge accomplishment because we have people supporting our mission. We have people who are validating our effort. But I think another big achievement is we piloted at a hospital in summer of 2022, and we're able to convert that into a paid annual contract for all of their staff members going into the new year. Again, is great news for us because it shows that people are willing to purchase what we're building. that people need what we're building, and that users want what we're building.
Absolutely.
So, I mean, those are, I think, the two biggest achievements our company has seen over the past couple of years. And then, of course, just smaller things such as winning pitch competitions, getting really positive feedback from users is like the best, achievement.
Right.
That's why we do what we do. And I think the goal for this year is to collect data on the effectiveness of our platform and to, take this one contract that we have to 10 contracts. And so that's what's kind of on the horizon for the next 8 to 12 months.
Definitely. I personally wish you all the best for that as well. And congratulations on the funding.
Thank you.
That is actually a booster, right, for you, your efforts, as you rightly said. I would now like to
Yeah.
turn to this discussion over to a very sensitive part of it. Like when we say mental health, so there has been, increasingly talked about in society now. We are seeing, the stigma is slowly fading away. People are coming out on social media more about it, right? Whether it's celebrities from Bollywood or Hollywood, some anywhere else.
Mhm.
Uh, but is this true that in healthcare, true in the healthcare workplace as well? Like it's very difficult for a person to think that a doctor is sick, right? When you say doctor is sick. Similarly, when you say, they are really having this mental problems at the healthcare unit. So, do you think it exists there as well?
Yeah, it definitely has long existed in the healthcare workplace. It's these physicians, nurses, they're trained to almost be like superheroes. They carry this high burden. They're always looking out for others, oftentimes at the expense of looking out for themselves. And even in their training, they're kind of trained to not be defeated, to always push through. But at the end of the day, healthcare workers are also humans.
Humans, right?
And it hasn't been talked about enough over the past decade just because people are at fear of losing their jobs, at fear of being seen as incompetent in front of their patients. Um, but I think one good thing that did come out of the COVID-19 pandemic is that it highlighted the stress that healthcare workers go through and allowed people to empathize, allowed people to be more comfortable opening up about it because everyone could see the toll that it was having on their day-to-day work days. Um,
Absolutely.
so it is being increasingly talked about. And as far as how the stigma of mental health affects us as a company and our journey, I think because we're selling to hospitals and health systems, oftentimes they want to invest in this. Now, our key barrier is will people use it?
Use
And
it.
to address that, we have built a couple features. One, we allow for completely anonymous and um, flexible solution, right? So people can, when they join coaching sessions, they can change their voice, they can change their username, they can keep their camera off so that
Okay.
they're not recognizable. They feel comfortable being vulnerable. Because it's a mobile app, no one has to see them walk into, a particular department, or they can do it on their own time. They can do it at the comfort of their own house. Those things like that, I think we've really thought about carefully to cater to that concern that healthcare workers might have. And then, of course, data security and privacy as well is something we take very seriously.
Right. Absolutely. That's what I meant, because there might be some resistance from the healthcare workers because they don't want to be seen as, on the vulnerable side.
Yeah.
So, yeah. So no, but definitely these features are going to give them the confidence that they can freely use the app and without having anybody
Sure.
judging them.
Yeah.
Talking about the features, let's continue discussion on the features of Vitalize app. So, what is the core feature of your app? Like apart from this, training sessions and meditation. So, what is the core feature that you can talk about, and what value does it deliver to the healthcare workers?
Yeah. So the core feature is the one-on-one and group coaching that
Okay.
we offer through our platform. So essentially, healthcare workers are able to open our app and they're able to speak with coaches that are also clinicians by background, meaning they understand what it's like to work in healthcare and they face the same challenges that our users have faced. And that's super important because oftentimes healthcare workers just want someone they can talk to that understands them, that can empathize with them. Um, and so our coaches offer a variety of sessions focused on, very on different healthcare challenges, whether it's coping with the grief of losing a patient, how to bear witness to suffering, how to achieve work-life balance, how to prepare for a difficult conversation to a patient, all of these different things that are very unique to healthcare that other people just don't get. And the great part about this coaching, as I mentioned, is they can be completely anonymous, and they can connect with other people on these calls that are going through similar things. Um, so that's really the core feature for the app. And then we complement that out, we round that out with mindfulness content, with text-based community peer support, daily check-ins, and other features. But the coaching is, I think, what draws people in.
Right. As I've also seen those little notifications that the app users are getting every
Yeah.
day. So those are pretty sweet messages and little encouraging messages every day they get on their phone.
Yep.
So yeah, so that's another way of keeping that confidence and mood lighten up every morning. Developing Vitalize platform, as much as your customers are happy to use it. So, what type of feedback or data you have received that demonstrates the impact of the product that you're developing? Like you must be having a statistical report or some feedback from the clients that you have signed.
Yeah. Yeah, so we're still in the process of collecting quantitative data, but
Okay.
we have definitely a lot of qualitative feedback. I think the fact that after piloting at the hospital, we were able to convert it into a paid annual contract is a huge sign of, the impact that we're having. But, so many clinicians have reached out to us and told us, they're so overwhelmed at work, they just want someone to talk to, and that our platform offers that to them. And things like that. We saw during our 1 month pilot in June over 500 sessions, active user sessions on our app, which was super promising. People want something like this, and we're going to continue collecting data. So hopefully I'll have a better answer over the next few months after upcoming launches.
Definitely, we'll wait for that as much as you do. And
Yeah.
as you mentioned, that it's 500 sessions on your pilot, right? So it shows that people are interested and they have that the back of their mind that they needed something like Vitalize Care.
Yep.
And anything you want to add as a closing? We are almost at the end of this conversation. So anything you want to add for Anuyat and for future plans? Anything you want to?
Yeah, I mean, we've loved working with Anuyat. I mean, I think with this upcoming big hospital launch, Anuyat has been super helpful. They've, you know, done things that typically contract companies won't do. They worked a weekend for us because we needed a feature built ASAP. They cater to our always increasing backlog of features and bugs. So, I mean, I've really enjoyed working with them, and I mean, future plans is really we're excited to get this first launch up and work towards future launches as well.
Perfect, perfect. We are also looking forward for that, future launches and all the other features that you're going to give to the community of healthcare workers.
Yeah.
And on the other side, also not just because it's an app, it's a human kind of a work also that you guys are doing. Like it's an initiative that brings you to another level of making people realize that healthcare workers they have the similar kind of a need, I mean, to be addressed on the mental level. So congratulations again to the
Thank you.
Vitalize team for all the efforts, all the success, and again, Sanketh, thank you so much for joining in today, and wish you all the best.
Thank you so much. Thanks for having me on.